everyone. Today we have our another new episode and we will discuss on health equity. We have our world famous speaker, Mr. David Schumacher from Transhumanist Party. You know, Bangladesh has a major issue about healthcare related challenge and uh, Transhumanist Party has many researchers, those who from this longevity research. So hopefully today's session will be very valuable and you know that World Talent Economy Forum closely work with uh, BIDA, Prime Minister Office, and we are working on different interesting projects. So health is very important. So Mr. David Schumacher, what you want to share? Then we have our another famous speaker, Madam Weber. Thank you for joining, Mr. David Schumacher.
Yeah, welcome everyone. Well, thank you for leading with the uh, discussion a little bit there about the Transhumanist Party. The first core value of the Transhumanist Party has to do with extending longevity and health span for as many people as possible. And obviously, health span is all about creating a good, healthy person for as long as they live. And we want that to be a long, long time. So I think that fits into the topic of health equity at some level. I'm the director of applied innovation for the Transhumanist Party, and I bring that up because I tend to look at things through an innovative entrepreneur type mindset, and so I tend to look at health equity that way as well. So the way I define health equity, especially innovation, health equity innovation, is developing and implementing approaches, strategies, and interventions that are focused on reducing health disparities and getting equitable health outcomes. To me, that seems to be the basis for what we would have when we're talking about this from the transhumanist point of view. We want people to have what they want, and most people I talk to want to have long, healthy lives, and that means not just in my state and not just in my country, not just in the particular social economic strata that I happen to live in, but everyone at the level that they want it. Okay, so that goes with a lot of issues. So, what are some of these innovations that are helping and can help in this health equity innovation space? Uh, One that I think that has really helped, and I know was fueled on at least in the United States because of the pandemic, was telemedicine. For example, the health insurance that I have would not cover telemedicine visits prior to the pandemic. And then when people couldn't get out, when people were urged to, limit their access to others, suddenly there was political will to be able to overcome the hurdles that had supposedly set back this idea of telemedicine. And this is extending on into other digital healthcare solutions. For example, I have a friend that has a chronic condition that must see a specialist. And in the past, they would have to do regular, repeated visits, laboratory visits, and so forth. And now they wear a device that captures information and then not a continual feed, but every so often then uploads this information to the physician's office. This is a very narrow scope, mind you, but it's a step in the right direction for being able to provide medicine from afar. And that becomes important from an equity issue because not everybody lives in a city. Not everybody lives close to where there's good medical treatment. So the idea of telemedicine and some of these other digital health solutions help spread this equity. But it goes beyond technology. Technology is part of it. It's a tool that we can use, but there's the human, the personal aspect of it, such as community health work, health worker social programs, people in the community that can work at a specific community level where they have a level of trust and communication to be able to open up these lines of communication between the people that need to be served, want to be served, and those systems that are willing to do that service. So there's also something called social determinants that play in line with that. So telemedicine is part of that, but that's only good if you have access to computer, smartphone, tablet, some kind of access to be able to do that. The digital healthcare solutions are only good if you're able to have, say, maybe the electronics that would report various aspects of your health condition back into some system. So such mundane things, and I say that with a smile on my face, are things like transportation. Is there public transportation? Is there a means to get to where you need to go? Is the housing safe? Is the water safe? Is the food and the air safe in those areas? So those social determinants need to be looked at. Sharif, Dr. Sharif, you mentioned Bangladesh. The culture there is different than the culture where I live. And even across the United States, the culture varies quite widely through all 50 states. So part of this of health equity is recognizing what those cultural differences are and looking for competent care that can address people in the culture that they live in, because that's how trust is a big part, and that's how trust and good health outcomes become a part of this. So some of this takes policy reforms. That's why not only am I interested in transhumanism, but I'm also interested in transhumanist policy, public policy, and what we can try to work into the established system, and in some cases offer alternatives altogether. So that's in health management, that's in showing politicians what technology is available and how it can be implemented and how this makes society better overall. So those are some initial thoughts I have from a health equity, technology, innovation, and policy viewpoint, Dr. Sharif.
You're muted.
Madam Viva.
Yes, good morning. Yes. Well, David, that's pretty good introductory remarks. I'm just going to pull one thing about policy into the area of the food supply, where my belief is that the human body has an incredible ability to self-heal, but in Western and developed nations, we're undercutting that ability very, very dramatically by allowing so many processed foods into the food supply. I know that people want their freedom and they like to have a choice of hedonic foods to eat, but as we can see in our baby boomers, this has really damaged a lot of people to the point where they're getting joint replacements. And now there have been causal links drawn to most of the major illnesses that are plaguing, including Alzheimer's and dementia, because of the food supply. So for emerging economies, I'd like to warn the people that are watching and say, if you can avoid processed food and eat whole food rather than fall into the trap that the Western nations have fallen into, to the point where the United States can hardly staff its military because the men and women who apply for it are so out of shape that they can hardly fill fill their needs. So, I mean, it's just it is an epidemic, and it is a health equity issue, because obviously people are not walking around armed with enough information about processed food. And this is what we need to do at least once in this show, is warn people that, you know, whole foods are going to be the key to healing and keeping you, preventing the major illnesses like cancer and heart disease and dementia. And joint deterioration, for example, has been linked to eating grains. So one of the problems I see with the food programs is that they're supplying wheat and grains as emergency sustenance to people, when that is actually damaging the gut barrier of those recipients to a point that has not been studied yet. But it is a risk factor. And so we do have some problems in the food supply policy that we need to grapple with. And I just thought I'd highlight those at the introduction. Thanks, Sharif.
Thank you. Now I request Mr. Jeffrey.
All right, hey everyone. So, yeah, I'd like to add like yoga and Tai Chi, this sort of light exercise, because not everyone, it's not always good to have really strenuous exercise. But I think for this we could also add, say, making sure you're flexible and you have good posture, and like breathing too. That's another thing that's always been talked about in ancient health wisdom, but now it's just sort of coming up again, I guess, in this time we're alive right now, is proper breathing to manage like stress and those, what do you call them, hormones and um, other kinds of neurotransmitters and stuff to keep you healthy. And yeah, that's just what I was thinking of. So right now we have um, like the body, mechanical health, dietary health, and then like I guess also mental health is another part of health equity we could talk about. I know now you can go on YouTube, and like I've just been going on YouTube and listening to like all these great, amazing audiobooks, about um, whatever, how to be successful, how to like meditate, or other kinds of fiction books like stories and all this. And it's great because, some people spent 50 years writing one book. Now we have the technology, YouTube, that we can just listen to it in a day or so. We don't even have to read it. So yeah, it's yeah, I think the technology aspect is also good, but it's also building a culture of of like this kind of stuff we're talking about, so that it can be ingrained and replicated by other people. So yeah, I think this is really good, and health equity is something that we can all, that there's so many um, levels of improvement that we can all discover and make and help each other with. So yeah, thanks.
Thank you, Mr. David Schumacher.
Yeah, great and wonderful comments by everyone. Thank you. I want to go back to healthcare equity a little bit from the innovation standpoint. And I thought when I saw the topic of today's show, I thought I would look and see what companies are playing in that space. Are there healthcare innovation companies out there? And I was happy to find that there are quite a few, and they're all looking at the different areas for healthcare innovation that I talked about in my opening remarks. Each one of them has taken a little piece of that and decided to work on that. And that's really what entrepreneurs do. They look for a need that's not being met, and they look and see if there is a way to be able to work in that space and create value. Now, sometimes when I say value, people immediately think of dollars and or whatever the currency is wherever you live. That's just one part of value, because there's also value to the community. There's value to offsetting costs. Like, for example, what Viva had talked about earlier was there's value to improving the quality of food because it improves mental and physical capabilities and raises the level of society from that standpoint. So that also is value. So don't just think of money when I say value, and don't just think of the high level, very public entrepreneurs when I talk about entrepreneurs. I'm talking more from an entrepreneurial mindset that looks at a situation and says, what can we do to improve this? What can we do to bring that value? And how do we package this value and get it to the people that it needs to go? So the names of these companies that showed up when I did just a few minutes of research looking for health equity innovation companies are not names that I'm familiar with, and probably wouldn't be names that the people in the audience would be familiar with either, but you certainly would be familiar with the problems that they're trying to solve. There's one that's called City Block Health, and they aim to address the social determinants that I talked about, bus schedules, location, things of that nature. They aim to address those social determinants by offering services in the places where the services are needed. And then there's another one called Health Leads, and they too are focused in the social determinant space, but they're taking it a little different. They're trying to connect the providers and those who need that, the different aspects of the social determinants that need to be met, such as good quality food, as Madam as Viva had pointed out, but also things as housing and transportation that I pointed out earlier, and looking for ways to navigate that these social needs can be met, because they all have to do with health. Another one has to do with facilities. This one's called Rubicon MD, and it's a telemedicine platform, and their focus is on underserved populations. So they're looking at tackling those specific issues. On yesterday's show, I confessed to being a bit of a technological geek, I guess, in that I have to have all the latest technology, at least in the areas that I'm interested in. And part of those areas are health. I mean, I've got a smartwatch that provides me a lot of health information. I've got a sleep tracker, but not everybody has these things. So you have companies that are set up to take on those tasks and work at improving access to specialists, medical specialists, remotely, and trying to break down those disparities that exist. And then there are others that are trying to help with the implementation of digital platforms, different than telemedicine. Maybe it's connecting providers, advocates, patients, care facilities, and being able to connect them all together so that there's a free flow of information so that people are better served. And the nice thing about being able to do this electronically is the fact that if there is some distance in these places, if there are a distance between where the population that needs to be served and where the resources are at, they can all be interconnected and have that information in a fair amount of time. There's software companies then that are looking at trying to find better ways to track referrals, to track, once again, providers and put them together, and being able to screen patients for the right kind of service and get them to where they need to go, because the patient themselves may not know where they need to start in this process. This leads to another company that's working not software-based, but producing directories and so forth to go into communities, so that those that need the care, want the care, can be connected. So it's not just a matter of electronics doing this. So there's various processes, programs, and services that are out there. And then there are companies that are kind of an umbrella that try to bring this all together. So companies, and later on I'll talk a little bit more about government solutions, but right now, companies that can work together with the patients in the area where they are, for the needs where they are, I think is a great way to do this, because it can bring the level of awareness of some of the things that Jeffrey was talking about, like yoga and Tai Chi and exercise and breathing and enriching your mind with audiobooks. These are all things that go towards health too. So we need a comprehensive program, and I loved looking through this list of health equity innovators to see that there are people focusing on that. And maybe we need more of that as well. But at least there's a start in that area.
You know what we could do is like an AI curated like health doctor that, because they already have AI that can analyze like cancer and stuff like that, like better than doctors. So if they had an AI that was holistic health, like a holistic health AI that like could tell you what Tai Chi stretches you need to do to like fix your back, or like tell you the book you need to read based on like the kind of trouble you're facing right now with your relationships or something, or what kind of food you need to eat, like based on the whatever, like color your pee or something. I don't know. But I think that could be a cool way to use AI technology also in health equity. And sorry to interrupt, but I just had that idea of using the AI for that.
But Jeffrey, that's a great comment, because I think what you do is you put the spotlight on what I was talking about, which is innovation and entrepreneurship in this space of health equity. It's great for many of us to sit and talk about how wonderful it would be if we did such things. But innovators and entrepreneurs are the ones that bring that value to the people. And as I spoke about earlier, that value goes far beyond just the dollars, just the currency that gets exchanged. So I think what you talk about using AI, say, to triage or whatever would be the appropriate level, would be a great innovation, and would be great to have an entrepreneurial focus behind it. And maybe it already does. It didn't show up in the list of the things that I was looking at, but that doesn't mean somebody's not working on it. Heck, maybe I should work on it. Dr. Sharif, I'll pass it back to you now.
Madam Viva.
So, Mark.
Okay, yes, I'm taking notes. My theme a little bit for this show is a little bit about lessons learned, at the preventability level, and I just wanted to bring up that, there is politically and policy-wise corporate policy that interferes with health equity. This is the way I'm going to phrase it anyway, that interferes with the ability of people to have a safer food supply again, and those would be the food lobby, the glyphosate lobby. The glyphosate lobby is worldwide now, and if you look at the graph of glyphosate going up and any one of major illnesses like autism, diabetes, metabolic issues, cancer, there is a correlation there that they think there's a causal link. So that lobby, we have to fight that. The sugar lobby, which now we have schools that have decided to remove sugar from their school feeding programs. And also the GMO lobby. I just read peer-reviewed literature yesterday that gene splicing has now been tied to outbreaks of cancer. So GMO may be an issue in our food supply as well too, and also that tech needs more work to make sure that we don't have cancer. The other health equity thing that I'd like to mention is in the United States, because you don't have a national health care program to any large extent covering the majority of your people there, and there's a lot of privatization. One of the things that's evolved is that the entrepreneurs and innovators in the health space of laboratories have put on the market affordable blood tests. So people can get their metabolic health and all kinds of health metrics like vitamin D levels and all these things checked with a finger prick test, and then mailed in and have it analyzed and the cost of that is coming down. So there's basically I think there are, 3 tiers of healthcare. There are the people that are runaway wealthy that can afford everything that they want and all their wants and needs are met based on their knowledge. Then there's the middle class and the lower middle class who are struggling to get service coverage, are also limited in their access and time to access knowledge. So their equity is affected by that. Their equity is affected by these big lobbies that I just mentioned, because we don't have a lot of people in the lower middle class that have the ability to force the change at the policy level. So, the upper middle class has to be responsible for that, and hopefully we'll get that happening. So the other one is diabetes. This is a huge problem globe-wide, and it's disabling people. People are losing limbs, kidney failure, this type of thing. And it's basically related to highly processed carbohydrates, which include sugar and flour products in different grains. So people need to be warned off of that as much as possible. Unfortunately, it has caused a huge, huge problem. I believe the statistic right now is moving from 70% of people in the United States are metabolically challenged up to 85% metabolically challenged. So it is basically a health emergency. And so this is where too much abundance in our world can get us into all kinds of rabbit holes of health problems. And I think emerging economies where they're still relying on more basic food, are closer to nature, need to understand that, ultimately they should not be coveting what the Western nation has in terms of its food supply, because a lot of it, to be honest and state it plainly, is junk. That's my input
Yeah.
for now, Sharif.
Thank you. Mr. Jeffrey.
Yeah. Right. Okay. Um, yeah, the food is definitely a good part, and that's maybe you could if you want write some of that food information down in the chat so everyone could like look at it and stuff. I think that's that would be really helpful, Mrs. Beaver. Um, and yeah, geez, health equity. Let health equity. Let's see. We talked about AI. And yeah, the other thing is the I guess knowledge of different techniques of healing and yeah, I think um I think I said what I said, and then yeah, I've got something else on my mind, but as I was listening to you guys, I got a little distracted. So um, what are some other things we could talk about related to health equity? Um, there's I guess there is food knowledge. I
Thank
want
you.
to say yeah, yeah, go for it.
Thank you, Mr. David Schumacher.
Play this role, and I think we all get caught up
Yeah,
in it.
so there we go. So the good comments continue. And I'll have some comments about the comments in a bit, but I want to finish the thought on innovation. I started out talking about kind of the umbrella subject of the areas that we needed innovation in as far as health equity is concerned. And then the next part, I talked about companies that are involved in this innovative health equity space. But now I want to move my comments more in the direction of public policy because it plays a critical role in being able to allow for innovation. Uh, Sometimes we need incentives because it costs money to innovate, it costs money to develop. And we can have the greatest uh, humanitarian ideas, but unless we can organize, hire, study, implement many of the things that Dr. Sharif, you're talking about doing in Bangladesh based on research and a number of those things, those all take money, those all take focus, those all take people. So public policy can help with that, but it can also keep unreasonable barriers up. Sometimes when somebody's developing new technologies, policies, whatever that might be, some of the limitations that were placed in the way of systems from the past may not apply, but you need to be watched in emerging areas. And sometimes they need this freedom of movement to be able to figure out what works, what doesn't work, what creates value, what doesn't, and they need space for that. So public policy can help with all of those things by uh, providing a supportive environment, by addressing those barriers that are there, and then these in the hands of people that truly want to bring value to this space, then can promote more equitable access to these healthcare resources. So, what are some of those things? Uh, Governments can work on just broad health equity policies that promote, perhaps by focusing and putting specific goals or targets out there for companies to shoot for organizations to shoot for, by listening to the public, listening to what's available in the business sector, and perhaps discovering areas that it would perhaps be beneficial for the governed area to be able to benefit from. So here in the United States, some other things that have helped has been Medicaid expansion in various states. We have Medicare, which is a national program, and Medicaid is a state-by-state program for those that aren't aware. And all 50 states have different levels of Medicaid, and finding out what works. One of the advantages used properly is that we have 50 laboratories, each state doing things a little different to serve their population because each state is different, but also trying different ideas. So covering, say, preventative services is something that works very, very well in all of these areas. And then the cultural considerations that I talked about earlier, those would vary state by state, and how those are addressed would be done. So it's good to have those done at that state or regional level. At the national level, making healthcare access more available. We've had some movement in that area, not as much as I would like to see, but we've had some movement in that area. The Affordable Care Act, for example, one of the positive from that was being able, because we do have not a single monolithic healthcare system, we do have privatization, being able to move a pre-existing condition from one plan to another was a great aspect for that, because many times here in this country, your healthcare insurance is determined by who you work for. And that can become kind of a golden handcuff, if you will. I'm working for this company. I have pretty good health care. I could improve myself and I can improve my family situation if I was to take a job with this other company, but I would have to go to new health care insurance and they won't cover a pre-existing condition. So I'm going to stay where I'm at. That limits what that person can do, what's available for that family, and ultimately what's available for the country itself as far as being able to apply the best people for the right job. So that's just one example of something that can be done at a national level. There are many others. Taking a look at the workforce for healthcare and the policies that can be put in place for that. So perhaps incentivizing more diversity in the healthcare providers is a good idea, not only just from, in my point, the basic human value of having as many people involved at the level that they want to be, but from a very practical level of trust. If you go back to talking about culture, somebody that's of your culture that's trained as a healthcare provider is easier to trust than somebody that's seen as coming in from another culture, no matter how well intentioned that person is. So things like healthcare diversity are more than just good ideas. There's an actual practical outcome as far as that's concerned. And then policy that address social determinants. How are bus routes set up? How are roads maintained and new roads put in? How are telecommunication lines? Those might be private companies like they are in the United States, but government has great influence over and can influence areas where they can build and develop perhaps additional customers for the company, but also those determinants that would help as far as, say, like telemedicine or digital therapies and so forth. Then we can shift into the software sector, and we can look at data collection, and we can look at medical records, and we can look at standard access and interfaces, once again, so that there's good cooperation and communication among all the players that are involved. And that's another area that public policy can have a lot to do with, as it can incentivize getting out of these silos, so that if I use different medical providers, they can all have access to the records that I wish them to have access. I still need, as the patient, still need to maintain control, but I want this to be as fluid as possible among all the different providers that are there. Engagement in communities and participatory decision making. So obviously, from a broad standpoint, that's a great and lofty idea. But when you look at perhaps underserved areas, this participatory decision making goes back to trust once again, being able to have them be educated, informed, and then in turn turn around and educate and inform those that wish to provide services and public policy that needs to be written. So it's not written by one population for another population. And then this goes back to trust. The last one that I want to mention right at this time has to do with health impact assessments. When something is built, whether it be something physical like buildings, whether it's public policy in a certain area, when it's new transportation, whether it's new business moving into the area, I think these ideas of having a health impact, as well as things like environmental impact and other statements, this is something that public policy can have a big impact on. And I want to point out, I mentioned 8 different things here. They're not siloed either. All these need to work together as well to create trust, good flow of information, and to be able to go back to what I opened with, which was the transhumanist policy's first core value on healthy longevity. It takes a multifaceted approach for us to get there. There is no one good solution. All these solutions are good. And working together makes them even better. So that's my thoughts on this subject. Perhaps when it comes to closing remarks, I'll address some of the other comments that I heard, because there's been some fantastic comments by some of the other panelists today. Thank you, Dr. Sharif.
Thank you. Madam Hiba.
Yes, yeah, absolutely wonderful knowledge base that you have on the understanding of the complexities of a highly developed medical system that is evolving even further. So I just wanted to pick up on one other thing. I did mention that it looks like there's sort of 3 tiers of health empowerment. There's the very wealthy that can get everything covered, the middle classes that are having the limitations which you're addressing, and the needs are coming out for a lot of the middle class in what you're saying there. And then the very poor, we still have people living in the Stone Age on the planet. Some of them are doing it by choice, but other ones are doing it via neglect or because of climate change. And so when do we start saying that needing water and food is a health issue? Like, that whole safety net that's not there for some of these refugee camps that I've had a chance to interact with a few people in them that have been living there. Some of them are 20 years old, and the people there, they're trying to organize to do productive work. The level at which they're working at is nowhere near anything that would need AI or any technology, because they're basically trying to make soap or learn how to cut hair, provide services to each other that are quite basic. So these basic economies that are, not leapfrogging off of poor quality emergency food because they can't even supply them with the low quality wheat and soy based products that are GMO as well too. So this is an area, there are three levels that I'm categorizing. I'm sure it's done in much more detail with a lot of the people that are studying the global health scenario. But for the viewers, what I want to encourage you to realize is that your own personal healthcare footprint, where you access the healthcare system, you are in a lot of control with your food, with your diet. If you turf the sugar and the carbohydrates, and frankly, if you were watching your blood sugar either with a ordinary blood sugar monitor or a continuous blood glucose monitor, which are now about $200, so that's affordable, you would see how much sugar and carbohydrate you do not need. And we've got to get our heads around the fact that, this addiction, this dopamine addiction in our society, where we do understand that mental health, people are now describing everybody's use of blue light on computers is a dopamine hit, and we're getting desensitized to our own personal reward ability. What we need to do, and I'm sure Jeffrey would agree, is to get offline, get out into nature, do some forest bathing, balance out all the frequencies that you're subjecting yourself to. And also, the other thing is understand that humanity is at its most chemically toxic environment it has ever historically been at. The numbers of chemicals that we have presented on with respect to our hydroxyl removal technology, getting these chemicals out of the atmosphere, for example, are absolutely stunningly numerous. So everybody is being bombarded by that, and everybody now has microplastics in their bloodstreams. So they just came out with a mouse study that I read this morning by Dr. Mercola's presentation, that microplastics now ride in your own, the fat that you take into your body will collect microplastics that can go and they can attach to the outer surface of the mouse's brain. So now we know how it's traveling around inside the body. It's been found in the pancreas, other organs, the bloodstream. It's been found in fetuses. So this whole, humanity has got to join hands and cooperate on stopping the chemists from adding more compounds into the mix. We've got to do a cleanse. We propose a global cleansing event along with a carbon removal at the same time. I encourage you to look at reductiontech.com for more information about that. But that's our contribution to, the health system from a technology perspective that uses a residue-free nature-based compound called the hydroxyl that naturally occurs in nature. So with that, Sharif, I'll let you take the helm again. Thank you.
Thank you. Mr. Jeffrey, what's your concluding remarks for today?
My concluding remarks is that even though there are microplastics, God made them, and all you have to do is resonate. I'm resonating on the frequency of God. So when you're one with God, the plastics are one with you, and you're not basically not fighting against. You're still. It's like you can try to fight against a current in the ocean, or you can let it flow past you. And so a lot of this health stuff, we gotta not, we gotta be, you can't be scared of something. That's another thing. Part of health is mental strength and optimism and hope, and and that goes a long way in believing and understanding how amazingly divine that the body is designed, and the mind too, and consciousness, and how we can all bring these things together to create a new awareness of health equity for everyone. So yeah, thank you.
Thank you. Mr. Martley, what's your concluding remarks or what
Well,
you want to
concluding
share
and
for
opening
our
remarks
audience?
like this. Concluding and opening remarks, I was just going to say that I've been listening, and yes, the health disparity is actually something that a lot of people are concerned about and are definitely very much passionate about. I know that as I get older, even though I live here in Durham, North Carolina, which is called the City of Medicine, there are a lot of folks that are unfortunately not able to afford the medical care that they need, even in a developed country like the United States and all in that space. And yes, there are clinics and there are ways that people can get the health care that they need, but oftentimes they are oftentimes run by corporations and others that are always not concerned about the anything but the bottom dollar. And we do know there is a heavy pharmaceutical industry here in the Durham area and in the Carolinas as well. So definitely that is something we have to stay on top of, because sometimes people can overprescribe medicines as well. Because I do know that that has been a conversation even here in this area, where people have been putting a lot of kids on Ritalin and on other things because they are feeling that they are being hyper or out of control and all in that space. And I'm not saying that medicines aren't needed, including some of the natural medicines, which I know that Jeffrey is a big fan of and all in that space. But definitely we have to be cautious in the way that they are prescribed, and also the power of the pharmaceutical industries in some of the health disparities that are out there. So definitely we need to be aware of some of these disparities, because unfortunately they hit too often our poor and minority communities, because they don't always have access to the clinics that they want to have access to, or the care that they want to have access to as well. So while it is a more pressing issue in the second and third world countries, I can't say that it isn't an issue that doesn't impact us as well, because we do know that there are a number of veterans that have gone through various issues, whether that's mental, physical, or other kind of things, and it is oftentimes difficult for them to get the care that they need in the um, economical kind of a way that they need it as well. So we do know that in a lot of ways, medicine is a business. I understand it's a business, but it also needs to be one of compassion at times as well, because sometimes people don't have the resources to afford the care that they need. And I think we definitely saw that during the pandemic, where some people were having some very difficult cares that they had to get to, and were not able to get those effective kind of care. So there is definitely health disparity both in the United States as well as around the global community. I do know there are other parts that it is a greater concern than it is here in the United States, but I cannot say that does not exist in the United States, because there are folks that have had to get surgeries and that were not able to get those surgeries, even if they were simple procedures like getting their eyeglasses or getting their dental work or getting a number of other things. Fortunately, there are some efforts at educational institutions that sometimes offer that care. So I do know that you can sometimes get your dental or your physical care, or even some of your mental care, by being quote unquote the subject of studies and doing things of that space and along those lines. But some of those are not always handled effectively either. So definitely I would just urge people to think about these issues on a regular basis, and to look at how they are being run and ways that we can improve them. So that's just some of my thoughts that I was having as I was listening to y'all in the background and all in that space. And sometimes you just need something simple, like some good music, to cure all of those problems that you have. So if I can, I'll just give a simple plug, and hopefully Jeffrey will be there. But a friend of mine is actually going to be doing a funk music concert on this coming Friday here in Durham at a club called the Pinhook. So sometimes that's what you need, is just some good old fashioned medicine of the mind. So that can also be effective as well. So that's what I plan to get this Friday, is some medicine of the mind with the Nappy Head Funk Army when they perform at that particular time. So sometimes we need that medicine from either a good book or some good music, and it can be of various sorts, whether it's jazz, blues, funk, or whether it's just a good old fashioned book that you can sit down and read in that space. So that is that emotional health that is also important, because I think that when we think about health, we need to think about all of the aspects of health, which is mental, physical, and emotional, and even spiritual health. So all of those are important aspects of our health journey. So I'll end on that note.
Yeah, I saw this study where I don't know if it's real or not, but they fed one group of kids like the best food and stuff at the school, but they didn't play with them at all and they weren't affectionate. And then they fed another group of kids just like like regular or like junk food even, and but they played with them, and then those kids were healthier than the other kids. So I think that goes a lot to show that science or whatever we use to measure it right now, there's a lot more to health than there's a lot more dimensions to health and ways that and easier ways that we can improve it um than like our that science or that is recognized right now by most sciences. But in like Eastern sciences and like Christian mysticism sciences, there's like all this is like pretty basic level health care, I would say.
No, I would agree with you, Jeff. And one of the things I would add is one of the greatest things that I think that both my younger brother, because I have a one sibling, my younger brother, as well as my dad, even though both dad and mom were involved in my nephew's care and are still involved in that nephew care, is that when they were very young, I would say that they were probably about 2 or 3. Dad and my brother got them out into kind of an environment of like where you're at. He got them out into nature, showed them the trees, showed them the various animals, and actually had conversation with them about that kind of connection to Mother Nature at a very young age. And while they have definitely got into the digital age because they are loving their Oculus and loving some of the technology that they are involved in, I do think that that early indoctrination and early thoughts into having a connection to Mother Nature has played well with their development as young men. Like I said, they're 14 and 15 and definitely heading into adulthood over the next 4 or 5 years and all in that space. But I have always thought of them to being tremendously level headed. And I think part of that was the kind of training that they got in learning about the simple things like the types of trees and the
Yeah.
types of leaves and even the types of plants that are out there
But
in our.
it's the music too, like you talked about dancing. The first time I went and I really like danced my butt off, like I didn't care like how if anyone was scared that I would be like dancing good or not or anything. I was at this music festival and I took some like I ate some mushrooms and then I was dancing and then on the dance floor, I like had this vision of my DNA like turn into this white pure light, and I saw like all the times my ancestors were dancing, all the times humans like danced around the fire before like recorded history, and like it really just helped me um like get in touch with myself and sort of um like be more healthy, I guess, or feel better and stronger,
No, I definitely
more
agree.
alive.
Yeah, I definitely
Yeah.
agree with you on that, and definitely that whole connection to music and dance is very much important, and I don't know that we pay enough
Well,
attention
it's
to that.
because the cymatics, like the sound vibrations and everything, like, and it tunes in with your heart and everything. That all has vibrations and frequencies in your brain and like your lungs and your breathing. Like, it all goes into like, yeah, creating I don't know, just
And you
the
mentioned
the
another
way
part of the,
God
and
made
Jeff,
it or
you
something.
mentioned another part of the health journey and the health disparity that I think is very important, because I definitely have some relatives that are part of the Native American culture, because I primarily identify as African American, but I do have some Native roots in the family, and some of my family identifies more with that than they do with other parts of the roots as well. And that being said, whether it's African or native roots, a lot of that is tying into our ancestors and some of the ancestral old style medicine. So while I am a fan of modern medicine, I do know that there are some cures that are out there in our natural plants that we don't pay enough attention to. But a lot of the native cultures, whether that's from Africa or the Native American cultures, do still pay attention to those. I mean, a good sweat lodge trip can be a good way
Dude, I
of
was just thinking
purification.
of that. You just like read my mind. And so maybe if the AI like thing can know like all these different kinds of health techniques, from like a simple like every kind of root medicine to like a berry, like it could just like, I don't know, help you or whatever. Because yeah, I don't know, it would seem possible. I mean, ChatGPT is like, I mean, it's kind of good, but yeah, I don't know, in the next however many like decade or so, if there could be a, because I mean, there are already, I saw this ad on Instagram where you hold your phone up to a plant and then it can like say what kind of plant it is and if it's healthy, what you need to feed it, water and stuff like that. So it's like, I mean, it's on the way, I guess, some kind of stuff that's gonna try, hopefully, we're gonna be able to use it to help us and make, make the world better.
Yeah.
So.
Thank you. Thank you. Mr. David Schwacker, what's your concluding remarks for today?
Yeah, I'll summarize briefly. I see we're running a little long. Once again, great comments from all the panelists. I have made a number of notes here that I'd like to comment on different things that were said, but I think I'll end with this. When it comes to health equity, when it comes to health equity innovation, when it comes to health equity entrepreneurship, whether it comes to you and your own health and how you interpret that health equity, keep in mind that you are the most interested party in this discussion. It's really up to you to focus, to discover, to learn, and to educate those that are around you. In other words, take active participation. This is what innovators do. This is what entrepreneurs do. We've identified a lot of areas that we wish that somebody else would come and do something for us, and that's great. But keep in mind that it's up to us to be able to spearhead these issues. It's one of the reasons that I mix transhumanism and politics together with the Transhumanist Party. Is it's not only good for me to have a philosophy of how I would like to see the future, but I need ways to be able to implement that for me and those that I care about, and hopefully for as many people as want that. So there are a lot of things out there, but remember to focus on getting what you need and working with those that are of like minds to be able to do that. And I think that's the final thing that I need to say before I go. And unfortunately, I do have to go. I have another obligation to attend to. So uh, I look forward to long health and long lifespans for everyone and prosperity for everyone as we move forward. Thanks again for another great show, Dr. Sharif. See you next time.
Thank you. Thank you.
Yeah,
Thank you.
bro.
Madam Viva, what's your concluding remarks?
Yes, we do live in a pretty complex world, with everybody living at a different level. And I agree with David. You've got to take your own health protection into your own hands and stay constructive and positive about it, and count your blessings for what you do have while you're confronting any of your challenges. The reality is we live in a physical chemical plane where these chemicals can interpenetrate and be released, and this is what's happened. It's not about fear mongering, it's about understanding the actual facts of existence currently with humanity at this time on Earth. If you can reduce your fear, get your sleep, get your nature, get your sunshine, keep your circadian rhythm in some kind of balance, not drink too much alcohol or do too much weed or too many drugs. Find your passion or one or two semi passions. You'll get along just fine. And remember, your health is primarily in your hands. Thanks,
Yeah.
Sharif.
Hey, Miss Viva, just really
Thank
quickly,
you.
do you think?
Thank you.
Yes, I know we're wrapping up, but Miss Viva, do you think
Yeah.
we pay enough attention to the chemicals and the things that are around our house? Because I know a lot of times we get detergents, we get a number of other things, and some of those also impact our health both here in the West as well as other parts of the world. So I was just wondering, do you think that we spend enough time paying attention to some of the health concerns that could be in the products that we also have in our house that are everyday products?
No, we don't. We spray paint, which causes a hydroxyl footprint depletion. We use our cleaners and chemicals, compounds, pesticides, throw a little bit of all of that on our garden when there are other options. We have to get off of chemicals as much as possible because the standard Western exposure to chemicals is 60,000 chemicals. Okay, that's a lot to throw at the human body. That's just absolutely ridiculous. And some people are going to be scared by that number, but the human body has cleansing systems that you just need to learn how to optimize and just avoid the chemicals as much as possible.
No, I agree because I think about how many houses and how many apartments. I know here in Durham we had some apartment complexes that were literally in the process of being torn down because of the asbestos in them. So we do know that there are a lot of chemicals even in some of the building constructions that we breathe in on a regular basis, whether that's here on the East Coast or on the West Coast or a number of other parts that we have to face all the time because they're in our literally in our walls and literally in our spaces, including some houses that have mold and mildew. I know that one of my one of my regular jobs, they just had a part of the building have some mold reduction because there was some mold that was taking place in the building, and that can be very much of a health concern as well. So I was glad that they recognized it and took action against it. But that's something that oftentimes people will have and not even know that they've got it in their house.
Yeah.
Thank you. Thank you everyone for joining today's session. This is really great discussion. I request all of our audience, please share our content with the government agency, corporation and academic. Thank you everyone for joining today's session. Thank you. Bye-bye and take care.
Take it easy.
Later. Yes.
See ya.
So, yeah, so you're